This week's assignment is on the IRIS module, Autism Spectrum Disorder, also called ASD. To my surprise, when walking into a classroom this morning at Pyle Elementary School, I was notified that I would be completing my observation assignment in a special education classroom with 13 children, all diagnosed with moderate to severe autism spectrum disorder. So I decided to not only complete the IRIS modules on ASD and address the prompts, but also collect more data on this disorder. Extra data. What is the definition of autism spectrum disorder? Autism is a complex developmental disability. It is the result of a neurological disorder affecting the functioning of the normal part of the brain. Now, the term spectrum means variations of challenges as well as strengths seen by each child with autism. That is why the syndrome is called Autism Spectrum Disorder, ASD. Extra data. What are some facts on autism spectrum disorder? According to the information I read on the article titled Data and Statistics on Autism, did you know that autism spectrum disorder is increasing at an overwhelming rate? Just in the United States, the estimated autism's prevalence is 1 in 68 children and has nothing to do with race, ethnic, and social economic background. It is proven that ASD happens 5 times more to boys than girls. Additionally, the first signs usually appear before the age of 3. Around 1/3 of children with autism will grow up remaining nonverbal, and only 38% will have an intellectual disability, which means a child has below average intelligence and a lack of skills necessary for day-to-day living. Prompt 1 is to identify the 2 major characteristics of ASD, and for each characteristic, provide at least 2 examples of how a child with ASD might display them. There are 2 major characteristics of autism spectrum disorder, with the first being continuous deficits in an individual's social communications and social interactions amongst diverse environmental and social contexts. The second characteristic is the presence of restricted, repetitive patterns of behavior, interests, or activities. The first example of social communication and social interaction is with 4-year-old Drew, who only communicates when he chooses to initiate the interaction. This is only because he wants an object that others have, or an item he can't get. His language is limited to the use of single words or short phrases to communicate. This shows how he has difficulty in establishing and maintaining reciprocal relationships. The result is he has no interest in peers and is satisfied being by himself. Another example of social communication and social interaction is with David, who is 2.5 years old. A quote from Iris: "He is not interested in peers, is nonverbal, and cannot communicate wants and needs effectively, and for these reasons, he has difficulty establishing and maintaining relationships." End of quote. He does not respond to many of the nonverbal forms of communication that many of us take for granted, like facial expressions, physical gestures, and eye contact. He is often unable to understand and express his needs, and also unable to interpret and understand the needs of others. Unfortunately, this impairs his ability to play and share interests in activities with other people, and may show to others that he is distant and indifferent. Since both Drew and David have difficulties with social interaction, this may manifest in areas of limited use and understanding of nonverbal communication, such as eye gaze, facial expression, and gesture, the difficulties forming and sustaining relationships, a lack of sharing interests and activities with others, and the difficulties with social and emotional responsiveness. A child with ASD may display unusual behavior or stereotypical body movement, such as flapping hands, jumping, lining blocks, or spinning the wheels on a car. An example of the second characteristic, the presence of restricted, repetitive patterns of behavior, interests, or activities, is with Drew, who, quote, lines up toy cars, end quote. He is not able to use objects, including toys and games, in an age-appropriate or functional manner, or the ability to do so may be delayed. In other words, behaviorally, Drew doesn't play with his cars in a way other children do. For instance, he turns his toy cars over and spins the wheels rather than pushing the cars along the floor or lining up cars in a specific repetitive pattern. Another example with Drew is he will throw a temper tantrum. ASD children often use temper tantrums to express frustration, for example, when trying to use a toy that requires fine motor skills beyond their current level of development. He may demand attention, obtain a tangible item, not being able to get the toy or object he wants. Also, he will throw a temper tantrum to escape or avoid an undesirable activity like going to bed or eating dinner. The second prompt is to watch the video of a mother interacting with her twins, Nathan and Benjamin, and to view the video on the assessment. Question 1 asks, identify the twin who demonstrates early warning signs of ASD and describe the warning signs. The second twin, Nathan, demonstrates early warning signs of ASD because he lacks the appropriate warmth and joyful expressions when playing with the toy car that his brother Benjamin showed when pushing the car back and even saying push. Also, Nathan did not enjoy pushing the car with his mother. Instead, he wanted to take the car and play with it on the railing, facing the opposite direction. Nathan did not respond to his name and ignored her social cues to try and keep the game going. Because of this, Nathan did not make a social connection to play with the toy car and his mother, who was trying to get his attention. Instead, he was looking around, not uttering anything, and even tried to climb off the chair away from her. The second question is, compare the behavior of the twin who demonstrates early warning signs of ASD to demonstrate. His twin brother Benjamin, on the other hand, was very happy and saying "off" when the car fell off the table. Nathan has delayed pre-speech gestures, as he did not wave or point at the car, nor did he utter any words, or express vocalization with his mother. This is in comparison to his brother Benjamin's emotions and expressions while playing with the toy car and pushing it to his mother, who would push back. Prompt 3 discusses that there are two ways that children can be identified as having ASD. The two methods are medical diagnosis and educational determination. One question is, compare and contrast the two methods of identification. The medical diagnosis is made by a licensed physician or psychologist using the Diagnostic and Statistical Manual of Mental Disorders, short for DSM-5, and diagnosing the child with ASD, a term that is commonly used by them. There are two stages, the screening and diagnostic evaluation, which is required for the process of obtaining a medical diagnosis. Now, the educational determination uses the term autism instead, which is made up of a multidisciplinary school team using the regulations of the Individuals with Disabilities Education Act of 2004, IDEA. The educational determination will give a child the required access needed for educational services and determines the eligibility of autism. It is recommended by the American Academy of Pediatrics that during the well-check exam around 18 and 24 months, using the modified checklist for autism is important. Now, after the screening process is complete, and if a pediatrician or psychologist identifies the child as having ASD, a diagnostic evaluation is conducted. And if the child is over 3 years of age, they are referred to the local state agency for an educational assessment. Meanwhile, the physician gathers information and makes his conclusion based on the child's overall development. This includes adaptive behavior, which is dressing, grooming, and feeding. The child's fine motor skills, such as holding a pencil, buttoning buttons, and using scissors. Next is the gross motor skill, like walking and jumping. He also investigates the child's communication and social interaction skills, which is understanding directions, expressing wants and needs, and the ability to interact with others. Family members or other caregivers are also part of the diagnostic evaluation, which includes seeing if autism-related symptoms are present, such as repetitive behaviors, sensory issues, and lack of eye contact. If the diagnosis shows the child has ASD, then the child qualifies for disability-related services. They are state-funded programs and health insurance benefits. Examples of both are respite care, supplemental security income and health coverage for clinic services, and applied behavioral therapy. Both agencies use the development of the child as a basis for ASD, but the educational determination also focuses on the child's academic achievement and intellectual ability, as it would be important for the educator to determine what the educational plan should be for the child. If a child does not have a medical diagnosis, then the public school system will complete an evaluation on them, which is conducted by the multidisciplinary team. Second question is, explain why having both diagnoses is important for a child and the family. Having both medical diagnosis and educational determination diagnosis is imperative for the child and their family because it determines what kind of services are available to the child. If there is only a medical determination, then the child will not qualify for special education services under IDEA. This is because their school performance would have to be adversely affected for special education services. Having both diagnoses would also allow for early intervention services and receive assistance under IDEA. This would allow the child and educational developers to assist in the appropriate methods for the child's development. Extra data. One of the most common questions after a diagnosis of autism is, what is the cause of autism spectrum disorder? Research tells us that autism tends to run in families. The changes in certain genes increase the risk of a child developing autism. If a parent carries one of these changed genes, then autism may be passed down to their child. This is even if the parent does not have autism. Other times, these genetic changes spontaneously grow early in an embryo. Again, remember, majority of these gene changes don't cause autism by themselves. They only increase the risk of the disorder. Another risk factor is autism's environment. Research also shows that certain environmental influences may further increase ASD in children who are genetically predisposed to the disorder, but this risk appears to be small. However, there is an increased risk with the age of each parent, the mother's pregnancy, and complications of the child's birth. For instance, if the child is born before the 26th week, premature, if the child's birth weight is low, and if the mother has a multiple pregnancy, like twins or triplets. Since some children are diagnosed with autism during the same time of their child receiving their vaccinations, parents believe this may be a cause, but it is a misconception. Research shows that vaccinations is not a risk factor of autism. Prompt 4 states, pick one of the scenarios about Jacques or David below from the challenge and answer these 3 questions. I chose to focus on the scenario of David. Question 1 and 2 asks, would this child or student have an IFSP team or an IEP team? Explain. And who are the required team members for this team? David would have an IFSP team because he is not 3 years old yet. However, in 6 months, he would have an IEP team. The required members of his IFSP team would be the parent and at least 2 professionals from different disciplines. One can be a service coordinator, and the other could be an early intervention service provider. The service coordinator would assist the child and the family in accessing appropriate services for ASD. This can be anything from making referrals to providers, scheduling appointments, coordinating services, assessments, and IFSP meetings. The early intervention service provider could be a board-certified behavior analyst, ABA, who is recognized for providing an effective overall strategy for educating students with ASD. They can assist with direct interventions at home, in school, or community settings to provide assessment and training. This is especially useful to introduce him to different methods of learning, since he is not able to communicate his needs. Integrating him into an educational process before school age would help him adapt in a school setting when he is of age. Question 3 asks, identify at least 2 additional team members that might be on this team and explain why. 2 additional team members that David will require is a nutritionist, because he is not eating appropriately and limiting himself to certain foods and textures. A nutritionist can find nutritionally balanced meals that are healthy for his development and meet his preference. Another professional he would need is a speech-language pathologist, who would help him with his communication skills, which is very important for his future schoolwork and participation in early child care programs and social interaction with his family. Prompt 5 asks us to read about Cherith, a single parent of 6-year-old twins, and answer the question, identify and explain 4 struggles or difficulties this mom might face. 4 struggles Cherith might face would be her high stress levels dealing with 2 twins who have ASD, especially since one requires almost total assistance with her daily needs, and the other child does not sleep. She would have high levels of fatigue caring for both children and staying up to make sure one of the twins is in bed, or performing safe activities while she is awake. Because both of her children have ASD, she would carry the financial burden of finding double the specialists who can address their specific needs, which may or may not be covered under her medical insurance. Prompt 6 asks us to read about Jacques and imagine you are Jacques' general education teacher. Using what you know about Jacques, select 3 strategies discussed in the modules that you could implement to increase his success in the classroom. Explain why you chose each and how it will benefit him. If I was Jacques' general education teacher, and I already knew his interests, by getting to know him, I would increase my chances of making meaningful progress by utilizing his interests. Because Jacques has poor reading comprehension, but I know he loves superheroes, I could introduce him to certain superhero character books to pique his interest and motivate his reading. I would also provide instruction in ASD-specific skills or areas such as social interaction, play, and leisurely skills by implementing a superhero play into the classroom that engages all of the students, not just Jacques. He would become more socially engaging, and his acting out would fit the context of the environment, which will allow him and the other classmates to finish their homework afterwards. Lastly, I would create a structured environment in the classroom that is predictable with a consistent pattern throughout the weeks, like reading, playtime, and math and science, at specific intervals in time with limited distractions and noise, as humanly possible with children. This would benefit Jacques because he would know what to expect and how to develop an appropriate context for the classroom setting with repetition. Reference were used from Autism Speaks, It's Time to Listen and Design. It comes from the website www.autismspeakguidestar.org. Data and statistics on autism on the website www.cdc.gov. The IRIS Center, Autism Spectrum Disorder, an Overview for Educators on iris.peabody.vanderbilt.edu/module. The IRIS Assessment on iris.peabody.vanderbilt.edu.